As women, we experience different changes in our breasts throughout various stages of our lives: puberty, pregnancy, after childbirth, menopause, or even during our menstrual cycle. So, in today's video, I am going to be talking about 8 important changes in the breast you should never ignore. While many of these signs are normal, some can indicate underlying health issues. So if you notice any of these signs in your breast, do well to see your doctor as soon as possible. Hello and welcome to my channel. My name is Sandra. I'm a registered nurse midwife with a BNSC degree. On this channel, we'll talk about all things health. If these are the type of content you're interested in, please do not make it your last by clicking on the subscribe button and the bell icon beside it, so that when I upload a new video, you'll get notified and be the first to watch the video. Please don't forget to like this video. With that being said, let's dive straight into the video. See, as a lady, it is important for you to familiarize yourself with these things, with how your breast looks normally, with how it feels when you touch them, the texture, the skin, everything that has to do with your breast. Just be sure that you know your breast so well, so that you can notice any changes early enough. Now, let's talk about those 8 signs you should never ignore. The first one is nipple discharge. We all know that nipple discharge is common among pregnant women or breastfeeding mothers. Now, as a lady, you are not pregnant nor breastfeeding, and you notice fluid coming out of your nipple, it is something you should pay attention to. The discharge can be clear, white, it can be yellow, it can be green, it can even be blood stained. So it can come in any of these colors. In most cases, you need to squeeze your breast for you to see the discharge, but sometimes you just see the discharge when you take off your bra. So please, when you notice any unusual nipple discharge, you need to get your breast checked. Don't just assume. See your doctor as soon as possible. Another breast sign you should never ignore is inverted nipple. Some women were born with naturally inverted nipple, which they've noticed since like puberty, and that is totally normal. In most cases, those inverted nipples come back out. But if you suddenly notice that one or both of your nipples are pulling inward when they were not so before, it could be a sign that something is wrong. Please do not ignore this sign. Always pay attention to new changes, and once you notice it, see your doctor immediately. Another sign to look out for is changes in breast size or shape. One breast is usually bigger than the other for most women. As a lady, you must have probably noticed that, which is normal. But if you notice a sudden or unusual change in the size or shape of one breast, or even both, see your doctor as soon as possible. It could indicate an underlying health issue, so do not ignore this sign. The fourth one is breast lump. Our breasts are usually lumpier before our period, and this is due to hormonal changes. Now, I know you'll be wondering, how can you now tell if it's the lump before your period or the unusual lump? So the best time to check for lump is a few days after your period ends. It's not going to feel like your regular breast tissue. It could either be hard. When you touch it, you feel that it's very strong, or fixed, that is just in one place, it doesn't even push, or just something unusual that wasn't even there before. So this lump is just going to feel different from your regular breast tissue. However, not all lumps are harmful, right? But it's always best to be on the safe side and get it checked. Please do not ignore any lump in your breast. Another change you should never ignore from the breast is dimpling. This is when the skin of the breast starts to look like an orange pea. You start to notice dimples in different areas of the breast, and this can affect the overall texture of the breast, making it look like an orange peel. So if you notice that your breast is starting to have dimples or tighten or change in texture, please see your doctor as soon as possible. The sixth one is flaky rash. If you notice that your breast or nipples suddenly starts to have rash, it becomes sore, itchy, cracked, or scaly, please do not ignore. The excuse we hear from this is that they'll say, oh, I thought it was dry skin. So it could be more than just dry skin. Always keep an eye on persistent rash or sore when you're not breastfeeding. If it's not going away, see your doctor as soon as possible. The seventh one is tethering of the breast. This is when the skin of the breast pulls inwards. looking like a dent on the breast. If you notice the skin of your breast pulled inward or drawn to a particular spot, it could be a cause for concern. Unlike dimpling, which usually occur in different areas of the breast, looking like an orange peel, this tethering of the breast usually happen in one area of the breast, and it's more noticeable when you raise your arm. If you notice this change, please do not ignore. Another sign you should not ignore is when you start to notice redness, swelling, or heat even when you're not breastfeeding. This is usually caused by mastitis, an infection that breastfeeding mothers usually get, which is as a result of cracks and sore on the nipple as you breastfeed, and it is caused by bacteria. So if you're not breastfeeding and you notice your breast starts to feel hot, sore, red, and engorged, please get it checked. It could be a sign of an infection or another health issue. So ladies, if you notice any of these signs on your breast, don't panic, but also don't ignore, because some of these signs may not really indicate that there is something wrong. It may be harmless, but it's always better to get it checked and be on the safe side. But sometimes these signs can also indicate a breast cancer. Always listen to your body. Early detection can save you a whole lot. Always do your breast examination and see a doctor if something feels off. If you found this video helpful, don't forget to like, comment, and subscribe. Let's share awareness. Share this video with someone who needs to see it. And always remember, your health is your wealth. Little changes makes a big difference. Thank you for watching this video, and see you in my next video. Bye.